misperception that they're all jacked up is kind of, really a misperception. I think it's important to kind of, acknowledge that there are stereotypes up front, and to counter those stereotypes, because I think
Mhm.
that's really important. And they bring just tremendous skills to the workplace. They're kind of more aligned with maybe what our first responder, police force, and firefighters go through, but but oftentimes even much more intense in terms of the types of experiences that they may have in combat zones. They certainly do.
Mhm.
Do they come home with the effects of that trauma? Do they? And so, there's been a lot of efforts on the part of both DoD and VA over the years to try to counter that stigma, improve, reduce barriers to care, improve access, improve people's, willingness to come in and get the care that they need. There's written exposure therapy. There's, certain
Yeah.
types of therapy that don't even involve a trauma focus at all. And having that flexibility of being able to shift gears with the patient, and look at what the broader range of options are, can be really helpful in helping people to stay engaged in care.
And so if there's an individual that's listening and they're thinking, whew, I probably would benefit from working with somebody about a traumatic experience I've had, but I know I'm not ready. We're here to tell you that it's okay to say, I need to slow down. I
Right.
need to go a little slower. Can we take this at a slower pace?
So it's important for family members to get their own care,
Hmm.
and to take care of themselves, and then, just like, on an airplane, you put your own mask on before you help your child, right? It's sort of, that kind of a perspective, so take
Hmm.
care of yourself. And then, but then, to the degree that you can continue to encourage your loved one to get care, that's, that is really helpful to a lot of veterans.
I feel like this time flew together.
Hmm.
And we're going to have to bring you back to talk some more. Thank you again for joining us on Choosing Help.
Sure.
I just want to say to anybody who is considering seeking help or who has a loved one who is considering seeking help, you can consult our website, choosinghelp.com. There's a resources tab, or you can contact us. And we're going to say goodbye.